Okay, well, welcome everybody. My name's Ian Allington. I'm the president of Manchester Trades Council that's hosting this evening's meeting. We'll be talking about zero COVID, a strategy for near elimination of the virus. We've got an absolutely fantastic lineup of speakers tonight, and then we'll have time to have questions and discussion. So we're asking all the speakers to just give a fairly brief introduction so we can have a bit more time for discussion. In addition to the advertised speakers, we're going to start off with an extra one. Julie Wilkinson, who's from the University and College Union at Manchester Met University, whereas you might be able to spot from the chat box there, about to ballot for industrial action over coronavirus-related issues. So I'm going to invite Julie to say a few words first of all.
Hello everybody, and thank you Ian for and the Trades Council for inviting me to speak on behalf of Manchester Met UCU. We're very grateful for that because this is a difficult situation that we find ourselves in at MMU. You'll have seen that the university had some very serious problems back in September when students first arrived at the university, and despite our best efforts to get the university to do appropriate preparation to make sure that students were safe and that we didn't have an outbreak of COVID, which we fought and argued for, and they wouldn't listen. And we had the worst outbreak in England earlier than any other universities, and great student protests as a result of that. And that theme of refusing to listen to the suggestions from the workforce, refusing to consult properly with us, is this sort of high-handed, arrogant approach that we've been getting consistently from our management, which we have now got to the point, and many of you will know how long it takes to get to the point of potential industrial action. We had a consultative ballot over only 1 week of our members to see whether they felt that we were in a position where we needed to take industrial action, and they supported us with the biggest turnout we have ever had for anything. Over 64%, nearly 65% of our members voted in 1 week, and it reflects the anger and upset. So not only are we being required to deliver face-to-face teaching, not when there are exceptions. Like, we're not proposing that students' educational needs should be disrupted, so that where you can't teach a course, where you can't teach it remotely, we're not proposing that. We're proposing that in those cases there should be special protection for both the students and the staff. But in lots of other cases where we can teach effectively online, we've offered those units, and the management have forced members of the university staff, not all of them, but most people have been required, irrespective of the levels of danger that they feel, to teach face-to-face. And in addition to that, the management have been, in our view, using COVID as a cover for introducing a number of workload intensifications. It was bad enough before we started. We have difficulty getting the management to obey their own recognition agreement, which they've signed. Right, so they don't obey their own rules. They sign things, agreements, and then they don't abide by them. They don't consult on workloads. The intensification of work at MMU has been incredible. We have had people have been just working flat out basically since April, right? So that most of our members have not been able to take the whole of their leave. Some of them haven't taken any leave at all. Most of us have been working 70, 80, even 90-hour weeks. People are cracking up with exhaustion, and the management have introduced new systems of delivering units, which mean that instead of teaching less face-to-face or having less contact with students under COVID, we're now having more. And they're now proposing that these things be brought in, these systems be brought in and made permanent. right? So we really have got evidence of the management just using the opportunity of COVID to really ratchet up the pressure and then intensify the pressure on staff. And this is despite the fact that the university continually boasts, and this is a good thing, it's in a healthy financial position. But those people who are earning vast amounts of money in comparison with the majority of the staff, a vice chancellor on more money than the prime minister, neither of them, in my view, earn the money. This is, some people on 400,000 quid a year, who are basically squeezing every last penny that they can out of us. And the effect of that on the quality for the degrees for the students, of which we are enormously proud, right? We really believe in education and we want to serve the students the best we possibly can. That's compromised by these management responses. The result is we have given notice of an industrial action ballot. The ballot is open from this Thursday to January, I think it's the 19th of January. And after that, we will see where we are, and we're hoping that our members will support industrial action. Of course, the thing is, we don't want to have to take the industrial action. We don't want to have to ballot. We keep saying to management, we're open for discussion. They're in the process of us with Governor goes, we went to ACAS. They came to ACAS meetings and offered nothing, literally nothing. So we're not, it would be an easy dispute to resolve. We're only asking for the same choice that the students have as to whether we work online or face-to-face. The students can choose to opt out of face-to-face sessions. We can't, we have to do it. And a workload model is something which in principle we could negotiate with the management, actually fairly quickly. There are some basic principles of fairness that we could agree with them. So it really does feel like they're taking the opportunity of the COVID crisis and the crisis in other universities of, losing jobs and so on, to exploit us even more. That's all I want to say at the moment, Ian, except that there's a Padlet. So I posted in the chat a link to a Padlet. So if you did want to send us a message of support, and Ian's already done that, and thank you very much for doing that, Ian. There's a link to it up there. I'm not sure. I could open it this afternoon. Josh, our branch organizer, tells me it's not quite open yet. So you might have to save it for a bit and try until later in the week. But you seem to manage to do it, Ian, so maybe it is available. And I could open it too. So if you want to, let us know that you're thinking about our concerns, we would be enormously grateful because it really helps.
Thanks very much, Julie, and certainly on behalf of the Trades Council, solidarity to all your members and the best of luck with the ballot. We all know how difficult it is to pass the totally undemocratic ballot thresholds in the anti-union legislation, but it is possible. And if people get stuck in, I'm sure they'll do it. So thanks very much, Julie. We, as I say, we've got an amazing lineup of speakers for tonight's meeting. So I'm going to move on to invite Janet Newsham, who's from the Hazards campaign, that's done an absolutely tremendous job before COVID and has done an even more important job during the pandemic in highlighting workplace safety and its importance for public health. So over to you, Janet.
Thank you very much, and thank the Manchester Trades Council for hosting this important event and for kindly inviting me to speak. And absolutely, you have our solidarity at MMU and other people that are in dispute or about to go into dispute. This is a really important time, I think, in terms of standing up for ourselves and working to keep health and safety and welfare of our members at the top of the agenda. So we've been campaigning to save workers' lives and prevent workers' ill health and injuries for more than 30 years. And whilst numbers have declined in that time, still every year more than 50,000 workers in the UK die because they've been exposed to toxic substances and toxic working conditions. which shorten their lives. And that is equivalent to at least 2 Grenfell Tower fires every single day. And we always knew that our government put profit and businesses before people's lives. We knew it last year before the pandemic was seeping into the news. And we know it every year on Workers' Memorial Day, when we read out the names of our loved ones killed because of work. But not to be so blatantly, we didn't think that they'd be so blatantly cavalier and dismissive of people's lives. And the huge death toll of workers goes largely unreported in the media. We thought because they happened in 1s and 2s, but this year it's very different. This year, thousands have died. They've died in hundreds daily at times. And in just a few months, the body count has surpassed the numbers of workers we remember annually. And they've been in the media. The papers around the world have kept count. They've published them daily. And most people you ask will know the number of fatalities approximately. And most of us know someone who's died from COVID-19 who have been left with chronic ill health as a consequence of being infected. What seems to have got lost in the headlines is that most of these deaths could have been prevented. Our government has failed to be held to account for these deaths publicly and politically. In fact, on a recent radio programme, one Tory MP suggested that the huge death toll was because not enough people died last year from flu. These people are inhumane. Early in the pandemic, the modes of transmission were known, not just the coughs and the sneezes, but the aerosol transmission. Early in the pandemic, it was known people could be infectious without symptoms, that children could just be as infectious as adults. Early on, we knew that work activities and workers in all different settings would be at risk if their employers didn't control the risks. We knew that this virus needed a precautionary approach to those risks, a proper standard of PPE, increased ventilation, less people in greater spaces, a hierarchical and layered approach to controlling the risks faced by workers and others in workspaces, in places like public transport, schools, care homes, pubs, restaurants, hospitals, offices, factories, shops, construction sites, etc. But this government didn't act to save lives. They acted to give away billions to their mates, to privatise essential and vital public services, to stampede ahead with Brexit, while our loved ones were left dying and buried alone. So we demand action. We demand a government that prioritises lives, that stops undermining health and safety law and enforces the proper precautionary and established standards for our working environments. Workers' lives are public lives. If shops are not controlling the transmission risks to their staff, then customers will also be at risk. If bus companies are not controlling the transmission risks to their drivers, then passengers will also be at risk. And if schools are not controlling the transmission risks to their teachers and other school staff, then children, their families and their communities will be at risk of infection. We demand urgent action to ensure all workplaces are COVID safe, that all risks of transmission are controlled, and this includes providing proper information, clear messaging about controlling the risks, providing additional resources and money to enforcement authorities and workplaces to provide proper ventilation, PPE, and people can afford to stay off sick, quarantine or isolate. In the hazards campaign, our message is simple. If you can't control the risks, you shouldn't be open. This isn't business as usual. This is to ensure the health and safety of your employees, their families and the community. Employers must be forced, if necessary, to comply with the legal duty to ensure the mental and physical health of employees and everyone else that's affected by the workplace and work activity. But more importantly, we need a government prepared to take the necessary action to stop the deaths, stop the transmission of the virus, ensure all workplaces are controlling the risks and set their sight firmly on COVID-safe workplace and zero COVID strategy to save lives and livelihoods. So thank you.
Thanks very much, Janet. Fantastic as always. And if people haven't checked out the website for the hazards campaign, there's an absolutely wealth of information on there, and I'd be astonished if Janet didn't post details of a few links in the chat box, as I think every meeting I've been in for the last few months that's been a feature. So I'm going to take next John Rees, who is from the People's Assembly, that's produced Zero COVID Charter that they're promoting to try and set out what the kind of measures that need to be taken to pursue a zero COVID strategy. So over to you, John, and welcome.
Thanks very much. Thanks, Ian, and thanks for the Trades Council for inviting me. There obviously couldn't be a more important moment to be having this discussion. I'm not sure whether what we're enduring at the moment counts as a renewed wave of the second wave or a third wave, but whatever it is, it underlines the callousness and the incompetence of the government. And that callousness and incompetence has a particular root. We saw it given a name in the first wave, the herd immunity theory, which they quickly dropped the language but not the practice in response to a huge wave of public revulsion at the thought that the best way of dealing with this was to simply let it rip through the population. But frankly, their management of the first wave, late into lockdown, quick out of lockdown, irrespective of what public opinion showed, or indeed what the best health outcomes would be, and the disastrous opening up of any measures to combat COVID during the summer, producing, as many of us predicted, a second wave in the autumn, and a renewed bout of attempting to play off livelihoods against lives. And that's what the government have done throughout this. Their constant argument is we've got to loosen the lockdown, we've got to weaken the measures to try and combat COVID, because otherwise we'll face loss of jobs and worsening conditions. And one of the reasons why we thought it was important in the People's Assembly to adopt a zero COVID strategy and to produce a zero COVID charter, and I put the link to that in the chat, is because we refuse to make that choice. We think it's unacceptable that people should be asked to choose between keeping their job or keeping themselves and their families and their friends safe. That's not a remotely civilized choice to be asked to make. It's only the kind of choice that barbarians and a homicidal government like this would force you to make. We don't have to make it. Other countries haven't made that kind of choice. This country is richer than many of the countries who've had a far more successful COVID record. In fact, the amount of money that the Tories boast about pumping into the economy is still a fraction of what they spent bailing out the banks after 2008. So we don't have to make this choice. There's no financial necessity for choosing to lose lives over losing jobs. And if we were to accept that that is the choice, then there are consequences from it. And the consequences can be seen in government policy. It means turning the old against the young. It means turning the most vulnerable, Black and Asian minority communities in this country, the old, against the rest of the society. It means turning frontline workers against others, those that can work at home against those who cannot. If we accept this kind of divide and rule, if we accept that we have to pay the price for the COVID crisis, it won't just be that we don't effectively deal with a pandemic. It will be that all the existing divisions between the rich and the poor, between different sections of the community, are worsened and made more toxic in the society. So there couldn't be a more important question. Now, I believe actually that one of the things that's happened during the COVID crisis is that there's been an opportunity for working people to show that they have more good sense, more humanity, and more organizational capability than the government. And you might not think that that's a hard bar to hurdle, but I think it's a self-realization that's gone on. I'm not remotely cynical about the Clap for Carers initiative that happened in the first wave. I think that that's the only sustained moment of solidarity that I can think of that was greater than the marches against the Iraq war. It saw millions of working people in ordinary streets and squares and blocks of flats around the country applauding another group of working people. It underlined the simple fact that it's on us that the society depends. I think that's fed directly into the increased numbers of people joining trade unions, some 20,000 more members of the NEU, the teaching union, some 2,000 more reps in that union. And of course, they took a very strong stand and have benefited because of it, I believe, in the first wave of COVID, and are on the front lines in terms of the schools at the moment, which in my view should be closed until the COVID numbers have fallen to the level that they did in the summer. So I think that working people have a moral authority in this crisis and are accruing because of that some organisational strength that's been lost over recent years. And I think it's now time to use it. I'm very glad to see the action at MMU. I'm glad to see the ballot taking place on the London Underground. And it seems to me that the action that teachers took was key to the safety of all of us. So I think there is a necessary opportunity that working people and their political organisations need to take now. And I think that the Zero COVID Charter should become part of the baseline of that debate in every trade union and labour movement organisation.
Thanks very much, John. That's great. And if people haven't seen it, there's a link to the Zero COVID Charter being posted in the chat box. I can see Janet's posted loads of really useful information from Hazards, and Roy has posted a thing to write to your MP demanding a Zero COVID strategy. Our next speaker is Richard Burgin, one of the MPs from the Socialist Campaign Group that's been doing a great job advocating a Zero COVID strategy. So I'm asking you to unmute, Richard, and if you can come in now, that would be brilliant.
Thank you very much, Chair, and it's great to see you all at this meeting. And I want to thank Manchester TUC for today's important event. And before I get on to why we need Zero COVID, I want to highlight really just why we can't afford to go on with the government's current strategy. Britain not only has one of the highest COVID death rates in the world, tens of thousands of unnecessary deaths, but one of the deepest recessions, the worst, in fact, the G7. And so the government's strategy of striking a balance between the economy and saving lives is a complete lie. And now we're on the verge of a deadly third wave, with the hospitals already near to the same number of COVID patients as the April peak. We've got the good news about the vaccine, but it's no silver bullet. It will take many months, perhaps a year, until it's widely distributed. So the government strategy has failed, and we can't go on for many months just repeating the same old errors. We do need a new strategy. So I want to look at why the alternative should be a Zero COVID strategy. Let's look at the figures from the last 100 days. Since the 6th of September, the UK has had over 23,000 deaths. In the countries that have followed a Zero COVID strategy, there were fewer than 500 deaths in total. That's across Australia, Thailand, New Zealand, South Korea, China, Taiwan, Singapore, and Vietnam, despite their population being 25 times bigger than our population. South Korea is the worst performing of those Zero COVID countries, accounting for half of the recent deaths. But if we'd kept death rates something like South Korea, a similarly sized country to ours, we'd have had fewer than 1,000 deaths since the very start of this pandemic. These countries have done so much better because they've focused on effectively eliminating the virus. Life is returning something much more to normal there, and the economy has suffered much less damage. In New Zealand, rugby stadiums are packed to the rafters. In China, nightclubs are full. What's so frustrating is that could have been us. We had cases down to 1 per 100,000 people in the early summer. We were on track to being able to eliminate it before the government told people to get out and spend, get back to work, and telling people it was their patriotic duty to go to the pub. The last issue I want to touch on is what policies we need for a zero COVID plan. Zero COVID seeks to eliminate the virus. It does that by driving down cases to low enough levels and then using test, trace, isolate and support to ensure those with the virus are not infecting the rest of the community. Our policy demands need to reflect that. Zero COVID is about locking down cases, not locking down countries. Lockdowns represent a failure to have the disease under control, but once it's out of control, they're needed. But if you are going to do it, then you've got to do it properly, not with half measures. So personally, I also think we should have extended the recent lockdown, which is why I voted against the restriction plan recently. And it's clear we'll need a new lockdown in the new year to drive down cases. But what else do we need to stop us going in and out of lockdown? Obviously, a successful strategy needs testing and tracing to work. So we need to kick out Serco and the other privateers and invest in the NHS and especially local public health teams. But testing isn't the goal in and of itself. The goal is to get infected people to isolate. We all know many can't isolate without proper financial support. And that's why I've recently organised for over 30 Labour MPs to write to the Chancellor demanding sick pay at real living wage levels for everyone who needs it. The government's £500 payment is too little and goes too far. It goes far too far, but doesn't go far enough. We also need to fight for other types of support. For example, there's thousands of empty hotels. They should be made available to those struggling to isolate because of cramped housing. And of course, we need to avoid unnecessary transmission. So COVID hotspots like universities should be shut, with teaching mainly online and students reimbursed. And a rota system needs to be in place for schools, and a push for smaller class sizes by rehiring teachers and using community spaces imaginatively. So these are just some of my reflections on why we need a zero COVID strategy. And I want to finish by congratulating again Manchester TUC for organising this zero COVID event. Never has it been more important for the organisations of the working class in all its diversity to argue for an approach which can actually do what the government's approach has failed to do, and that is to save lives and save livelihoods and create a better future.
Thanks very much, Richard. And I think that was a particularly useful contribution, given that we missed our first speaker, Dr. Scally, who I'm sure would have explained more of what the zero COVID strategy is. So that's been very helpful, I think, in helping fill that gap, as well as all the other excellent points you made. So our next speaker is Dr. Emma Runswick, who's an activist in the British Medical Association, the Doctors Union, and is also involved in the Zero COVID campaign. So I'll over to you, Emma.
Brilliant. Thank you very much, Manchester Trades Council, and also to Richard Burgin. I thought that was excellent. It's quite rare to hear MPs give focused contributions, and that was excellent, so well done. I'm a junior doctor in a Greater Manchester hospital. I'm a BMA rep and I'm a member of the Zero COVID campaign. And I'm going to start by asking Ian to share some slides that I sent him and talking a little bit about what COVID is and what it does. Because we know it's a virus that causes multi-system disease in the lungs, but also in the brain, the heart, the kidneys, and other body organs and systems. And I haven't got the most recent figures, but in the first wave, around 3% of people who had COVID needed respiratory support. And for some, that means oxygen via a couple of plastic prongs in your nostrils. But for others, it means CPAP, continuous positive airway pressure. So this is oxygen delivered at about 30 miles an hour directly into your face. It's particularly uncomfortable. It's delivered through this tightly fitting mask normally, but these leak. So healthcare invented some nice fancy 3D printed scuba masks adapted for the purpose. If you show the next slide, Ian. So this is what we're using now in our COVID respiratory wards, and you'll see whole wards of people on these machines, which are very noisy and very, very uncomfortable. For some, it means invasive ventilation, which is on the next slide. A tube through your mouth, down your throat and into the top of your top of your lungs, the breathing tube called the trachea, where we render you unconscious and mechanically ventilate you with a machine. People intubated, unconscious and mechanically ventilated due to COVID currently make up 116% of my hospital's usual capacity on intensive care. That's more than 100%. We've expanded our ICU capacity. Other conditions that require intensive care are being cared for on our stepped up high dependency unit, which also has some capacity now for mechanical ventilation. And we are at an improved stage from the point where all of our operating theatres were also being used as ICU beds. But it is pretty horrific. It's not a nice place to work in. It's difficult. You've seen the pictures of us with the lines on our faces from our masks and so on. But it's very, very horrific for patients to go through. This is not an easy thing to comprehend. It's a less easy thing to survive, even for the youngest and fittest of us. And on the next slide, we've got a picture of Jack Edge, who's a 17-year-old lad who spent 12 days in ICU on a mechanical ventilator like that, and has survived with significant nerve damage. I say that again, 17, completely healthy, but now he's walking on crutches several months after his ICU admission. So survival is rubbish. Obviously death is worse, but it puts it into context to say on top of our 65,000 deaths are survivors of serious illness like Jack. The ONS has just released figures on long COVID saying that about 10% of people who've had coronavirus, so that's around 12,000 people in the UK, are still suffering symptoms of COVID. There's a 12-fold increased risk of stroke, a 9-fold increased risk of diabetes, 10-fold increased risk of kidney failure. Ongoing fatigue and pain is felt by more than 10% of those people. And this is the crucial health context. We've heard about the education context and the economic consequences, but this is the crucial health context that demands action, not just words. It demands a zero COVID strategy. Thanks, Ian, you can stop sharing. It demands action at multiple levels. It demands action at the political level that Richard's talked about, crucial, tried and tested public health measures that have worked in other countries, even countries that have faced as difficult a situation as we are in. So in Australia, in Victoria, when they had deaths at the level that we have, around 600 or so deaths a day, 700 deaths a day, they implemented zero COVID and they have now achieved near elimination. You can take action now by doing zero COVID strategy work in this country. So I think somebody has already posted in the chat our tool for writing to your MP. Obviously, if your MP is Richard Burgin, you don't need to do this, but if your MP is somebody else, please do that task. We are also building in the zero COVID campaign towards 16th of January Day of Action, where, as in the past, we will be taking safe, socially distanced outdoor events and having a simultaneous online event, as far as I am aware. It also requires workplace and community group action. You can set up zero COVID groups with only 3 of you in any workplace or community group. You and your colleagues in your union can use our assistance, our resources, to achieve concessions, to achieve wins in your workplace or community group, to make your workplaces safe, whether that's home working, whether that's distancing, whether that's PPE, whatever it is. People have won changes in their workplaces, notably PCS has done so in the civil service. You can do the same. Please come and join us, get involved. You can also do quite a lot to help shape, I'm there, help shape the zero COVID campaign by doing that, because we've got lots of autonomous sections. There's also something that you can do on a personal level. So we've got political level nationally, workplace level and community level, personal level. Just because you can doesn't mean you should. I hope from what we said from hazards that we understand that law does not equal safety in the UK. And I really beg you to think about what your plans are over the festive period and what you can do to keep your friends, your family and yourself safe, and not give anybody COVID for Christmas, and not make my January as horrific as my 2020 has been. So please join Zero COVID. There's lots and lots of information on our website, and I hope that this discussion is fruitful. Thank you.
Thanks, Emma, and thanks again to all of our speakers. Manchester Trades Council supports the Zero COVID strategy. That's why we've put on the public meeting this evening. We support the People's Assembly's charter and the Zero COVID campaign. And as various speakers have said, it's absolutely critical at the moment. We can see with Christmas fast approaching, and I don't know how many of you saw or heard Boris Johnson today talking about his confidence that individuals would act responsibly, but the idea that individuals have genuine choices when people can't afford to take time off sick, can't afford to isolate, and maybe can't afford to have the windows open and ventilate their homes over Christmas, and have it warm enough. It's like the old saying about having the law being equal, everybody rich or poor is banned from sleeping under bridges or stealing bread, but only some of us need to. Well, it's the same with this. We don't have it. We don't have genuine choice if we don't have the money, the resources, and the power to be able to exercise those choices. And that's why unions are so important in advancing this. We can win changes at workplace level that have an impact not only on the safety of the people in the workplace, but actually on the communities we're part of and our families and friends as well. So I want to open up the meeting now to discussion.
Yeah, thank you, Alice. I live in North Manchester. I wonder why the response from the opposition seems to be so ineffective. There doesn't seem to be a coherent strategy in any way, mostly supporting the government unconditionally. And I think there are so many ways we could be offering, both economically and in terms of health, better alternatives than what the government's doing. Why is the front bench not doing it?
Yeah, thanks, Ian, and thanks to all the speakers. It's been a very, very good discussion. I think it's important to realise that we are really the silent majority on this issue. Most people really do want serious measures to suppress this virus, but our voice isn't heard. I mean, there are very few voices in Parliament. Richard is a very noble example, but an exception, because there's very few voices in Parliament pushing for a zero COVID strategy. And yet I think it would be extremely popular if people could see how much freer life is in New Zealand, Vietnam, South Korea than it is here, and that there is a way out of this terrible crisis, which is a zero COVID strategy. Yet we only really hear the anti-lockdown voices, and the only people we see prominently on the streets are the libertarian and far-right conspiracists. And that's why I completely support what Emma was saying. We need to take action. And those unions that are balloting to have safe workplaces are absolutely right to do so, and we should 100% support them in every way we can. But we also need to take action ourselves. Everyone could take action to push for zero COVID. And that's why this campaign has been set up. Now, just to add a bit more detail, we're going to have an online rally with Diane Abbott and Kevin Courtney on the 16th of January speaking, and other very good speakers. But there will also be socially distanced, masked, risk-assessed protest action in towns and cities up and down the country. And the difference with that is that will grab media attention, and we need to get this case across. So it's the 16th of January. Please put it in your diaries. 11 o'clock in Piccadilly Gardens. There will be a safe, socially distanced, with the full support of the police and everything. It's fully legal, but we need to take action, because the only people that we're seeing on the streets are literally the far right and the libertarian conspiracists. We all need to come together at this stage and take action. Thanks, Ian.
Hi, just I suppose a fairly simple question. Do we actually know from all the expert work that's gone into the zero COVID strategy how long it might take, with a full UK-wide lockdown to reduce things really close to zero and to properly implement the sort of find, test, trace, isolate, support system that will keep on top of it. I just feel that within the wider public, or I wonder if within the wider public, because of the start of vaccinations, people might have mentally switched off and think that it's nearly over. And they might think, well, what's the point of pressing hard for this strategy when, we're going to get out of this soon anyway? I understand from Emma, and I guess when I sit down and think about it, that is not the case, but I'm just wondering if we have any feeling on how long that would actually take. Yeah,
so Victoria and Australia, who were in a similar kind of position to the death rate we've got currently, had 112 days of lockdown, which is obviously a third of a year, or approximately a third of the year, from August. Is that about right? From August, I think it was then that kicked in. They obviously have slightly different concerns to us. So we have some benefits in comparison. So we have the benefit that we're an island, or I suppose a collection of islands. There are some places in the UK that already have zero COVID, notably several of the Scottish Isles already have zero COVID. There are places which we would not have to lock down in this way to achieve it. You could implement strategies that further broke down the UK to reduce the amount of time that you required, particularly in certain areas. So you could have travel bans between regions, for example. They also benefited from having a working test and trace system to exit to. We don't. So despite the fact that we got down to near elimination, or the point where we could have had near elimination in the summer, our absolutely disastrous, not test and trace or support at all system has completely destroyed any prospect of that for us. So that would need to change for this to work. So there's several things that we could do to make it less time than that, but it might mean that it was 10 to 12 weeks. It might be, but to be honest, I would prefer that to constant in out, shake it all about mitigation, where we are constantly at threat of another wave. I mean, we're already predicting a third wave in January, February, and we'll have another set of deaths. And we're going to keep pushing back the time when we can catch up on non-COVID work in the health service. We're going to keep putting off those knee and hip operations, keep putting off those specialist assessments for everybody else, because our hospitals are full of patients with COVID, patients who should not, in normal circumstances, be unwell at all. I haven't got anything to say about the strategy of the front bench, but I assume that Richard will.
Hello, thank you so much, Ian. I think that I'll just want to direct this question to Richard Burgin. My name is Sanaz, and I am a member of Unis versus Border Controls, and we are a national campaign against the hostile environment policy inside higher education. And we work with other groups that are opposed to the hostile environment policy, like Docs Not Cops and Schools Against Border Controls, just to name a few. My concern is that in terms of the vaccine process, what provisions are being met to ensure that all migrants, including those who are asylum seekers and undocumented people, have a right to get the vaccine and have the vaccine free? Because we're concerned that this might not be the case, and that there's going to be a huge segment of the population who will be unvaccinated and will suffer major repercussions.
Just the thing that made it very, very difficult for us to mobilise our members around protecting their own safety was a really particular legal point, right? Which is that if, as a trade union, right, obviously risk assessments, right, have to be legally. What's Janet will know the phrase, suitable and sufficient. I put it in the chat. They have to be legally, they have to be suitable and sufficient to protect your health, right? But if you want to take action on that, you have to refuse individually to enter an unsafe workplace. And if there was a legal case, and I can't remember the name of it, right? But a union was fined for taking action which was seen by the courts to be collective action in support of suitable and safety risk assessments, right? And they were fined for doing that. And we have been completely constrained in terms of persuading members to act, because we've had to say to members, we can't encourage you to say that these risk assessments are not suitable or sufficient. We're not allowed to, right? And this completely neuters what we're able to do. And it means that where workers are feeling that that the things are really not safe, they're faced on an individual level, which the colleague who was talking about the campaign, the Zero COVID campaign, was talking about this. People are faced on an individual level with a potential for losing their jobs. And it's particularly vicious against those people who are at particular risk, right? So it's really unequal. So if you're a single parent, right, you're a single parent in looking after kids, right, and you are particularly at risk, you're more at risk if you then have to put your own job on the line, right? So it's really unfair and unequal. And I think, I know it seems like an arcane point, but a combination of but some legal action, right, if it were possible to win something. I mean, I know that in Parliament it's very, very difficult to do this, right, but there might even be Tories who think that it's a bad idea, okay? I mean, I know that we're, I just don't think we can wait until to begin to discuss those issues and try and get that changed. And I would see that working. It's crucial for the trade union and labour movement to be able to collectively respond on safety, right? That's one thing. And the other thing is the Health and Safety Executive, which has been defunded to such an extent, right, that definitely contributes to the failure in this country, right, along with all the test and trace and the lack of preparedness and all the mistakes that the Tory government has made. Along with all of that we haven't been able to defend ourselves because we've got no backup, right? Even the laws that we have got, right, the Health and Safety Executive. Now, I know that when I'm talking and speaking in front of Emma, Richard and other people, you'll be aware of this, but it's incredibly important. And it's almost like it's sort of not quite, a lot of health and safety law issues don't seem all that sexy, right? But this is about people's lives, saving people's lives. So I think that framework is really important.
Well, yeah, and absolutely support what Julie's saying. During this pandemic, the HSC have been like a secret society. They've not been visible. They've hardly, they reacted really slowly. They went into lockdown. It took them weeks to start to respond to some of the concerns. They discouraged people raising concerns. They've discouraged employers from reporting where they've had cases. So we've got a real problem. And a lot of that's to do with the fact that they've been massively underfunded. They've had 50% of the funding cuts to them. So they're not in a position. And now they're ringing up people. And when they're looking at complaints, they're ringing up employers and saying, well, are you actually doing this, that and the other? Yeah. And the employers are saying, yeah. And the HSC are saying 80% of our employers are complying with health and safety law and doing the risk assessments. It's a bloody nonsense. How do we know that? And before, when inspectors used to visit sites, they used to talk to the safety reps and get an independent view as to what the employers were doing. Now they're not even doing that. So they're not only not visiting, but they're ringing up employers, and the people that, who could be up for liable for negligence or whatever are saying, no, we're doing it perfectly. I think there's a massive problem that we've got going on in terms of health and safety and enforcement. And that's what we need. That's what our reps need. That's what our members need. They need to know and what vulnerable workers need that have not got trade unions supporting them. That's what they need. They need to know and be assured that there's an enforcement body that will step in when they're in danger and we'd be protected. And I think just going back to the point that was raised about zero COVID, we need a circuit break. We need all schools, we need all non-essential workplaces to shut down for a period of time while we get that test, track and trace and everything established and working and back in public hands. And schools especially, you know, that all that transmission of the virus in schools and all these workplaces that the governments tend to think of as not workplaces are causing us a problem. And we need that to be put in place. We need the COVID safe strategy in place. And I have to just say on the front bench, you know, on the opposition bench, it's horrific to us that there's not been a louder voice in Parliament speaking on behalf of workers and, you know, and challenging the government to what they're not doing. And I think, you know, there's a lot of people that have got some answers to, well, some things to answer is after this finishes, but we need people to step up now. We need, you know, people like Richard, who's done a fantastic job, you know, and not saying that you haven't done it. I think you're, you know, one of the lone voices, but we need the opposition parties to step up and shout.
Yeah, and just to come in with some concluding remarks before I have to disappear off the call, I'm afraid, but it's been really good to be at this meeting and listen to the other speakers and also the contributions from the other attendees as well. The case that one of the colleagues referred to about the union being fined for the collective action that the courts determined they took was the Prison Officers Association. And that was a very regrettable judgment, shall we say, in the least, but it exposed the nature of the law in this country, didn't it? And obviously the law needs to fundamentally change in favour of working people and in favour of trade unions. The point that the colleague made about the vaccine being made available to all migrants and to all people, for example, who are homeless, all people of no fixed abode, is very important, isn't it? Very important indeed. Important, obviously, for the health of those people and need to be viewed as they are, as equal to every other person in this country and around the world, but also good for the collective good of the community as well, because hoping that the vaccines prevent transmission, the more people that have the vaccine, the safer every single person is. So we really do have a common interest in keeping every single person as safe as possible. In relation to, and of course, the point I'd make is as well that in this time we're going to see greater and greater scapegoating of migrants and minorities. So there's a bigger duty on us to argue against that. It's a more urgent duty than it has been for a long, long time, I'm afraid. Then a colleague mentioned about the front bench position. If I had £1 for my campaign fund, obviously, £1 for every time I was asked why someone else's position is wrong, I'd be I'd have a very full campaign fund, to say the least. Whether it be on this issue or other issues, I can only be judged on what I say and on what I don't say. And what would be a good idea, however, is for the People's Assembly Against Austerity and for the trade unions to carry on lobbying the Labour front bench, the Labour leader, the Shadow Health Secretary, and putting forward your points of view and the experiences of your members in the workplace and the people you represent in our communities. I think that's very important indeed. As I say, I was one of only 15 or 16 Labour MPs who voted against the government's plan the other week, but not all Labour MPs who voted against the government's plan voted against the government's plan for the same reasons. The reason I voted, along with others, against the government's plan was because I believe the lockdown needed to be extended with proper financial support in there as well to save livelihoods, whilst at the same time saving lives and trying to get the virus down to a low enough level where we can move forward in a safe and positive way. So I'll carry on arguing for a zero COVID approach. I welcomed it when Labour called for that circuit break lockdown, but people should, of course, lobby their MPs, and people should, of course, lobby the Labour front bench to take the position that's necessary. The point I was going to make about my vote against the government's plan the other week was that I think that MPs on the front bench and the Labour leadership needs to understand that everybody in this country has an opinion on this crisis and how it should and shouldn't be dealt with. Everyone has an idea and an opinion on what needs to be done to save lives. Everyone has an idea and opinion on what needs to be done to save livelihoods. So people won't have and don't have very much sympathy with abstentionism on this. People want us to take a stand, because if we can't take a stand on the biggest public health and economic crisis that the working class in this country has faced for a century, then people will be forgiven for asking, what are we going to take a stand on? So I'll continue to make the arguments. Other Labour MPs who support a zero COVID strategy will continue to make the arguments. But I think it's vitally important that all the unions involved in the People's Assembly Against Austerity and the People's Assembly Against Austerity itself and the individuals who support it all lobby their MPs and lobby the Labour front bench as well to take a more robust position on this. Doing nothing is not an option, particularly with this horrendous crisis.
I wanted to say a couple of things myself, partly in response to Julie's points around health and safety, because we've got this hostile legal framework towards workers generally, but also the complete failure of enforcement, and the two are like a pincer that are catching workers in the middle. But it's worth remembering back to the start of the pandemic in the spring, when quite a lot of workers, even workers who weren't in unions, did take action, both individually and collectively, because they were so alarmed at the safety risks they were being exposed to, and they did get movement from employers in a great many cases. But that legal framework makes it so much harder than it should be. And I think one of the things that, as trade unionists, we've got to get better at is finding the things we can do that then build up the confidence towards the things we need to do. So whether that's, I saw someone had posted in the chat about, doing non-workplace stuff to raise people's confidence to protest or whatever. But similarly to workplace, there's a lot of collective actions that people can take that don't involve needing to have a strike ballot, that can then make people feel more confident that they're not alone if they then have to refuse work technically as individuals. It can create a collective of individuals, if you like. And then there's help available there. I mean, certainly from my experience in work, the Hazards Campaign and the Hazard Centre are absolutely fantastic at providing advice and support with any of those problems. And I know Emma's wanting to come in, but when Emma spoke at the People's Assembly demo a few months ago, talking about the BMA are willing to write to employers or get doctors to write to employers, telling them, what you're doing isn't safe, and if necessary, writing to the press about the fact they've had to do that as well, which is a very powerful campaigning tool that certainly, in my opinion, we're not using enough. So on that note, I'll bring Emma back in.
Yeah, so I had that point to make, so that if you're having problems at work, any safety problems at work, we have commitment passed policy at our national conference in September, which was done virtually, and we have so far in the Northwest done this twice, writing to employers, and not once written to any press yet, to chastise employers and shame them for doing things that are averse to public health. So we are willing to do that. We have public health professionals who are willing to do that, and you can contact me. I'll put my email again in the chat. I also wanted to comment on the vaccines. So we've seen now the safety and efficacy data for at least two vaccines that I've read the papers for, both the Pfizer vaccine and the Oxford AstraZeneca vaccine. The Pfizer vaccine that we're currently administering, to many thousands of people, we are administering to those most at risk of serious illness and death from COVID. And the reason is that the data that we have for that vaccine is that it prevents you developing the disease if you are exposed to the virus. We do not have data for that vaccine on whether it reduces transmission. And that's just because they didn't collect it. We could make a safe assumption but we don't have the actual data. And that's why health workers are not top of the list. For the Oxford AstraZeneca vaccine, we do have data that reduces transmission. So the combination of those two vaccines, and possibly others as they come to market, as they come into use and production, will be a way out, but not for a while. The second question about reaching people, absolutely agree that we need to get to everybody, including undocumented people. We do know how to do that in the health system. We've got experience, notably with TB, of reaching undocumented, homeless, asylum seeker populations, people who are moving on a regular basis. So we have lots of experience doing that. It is possible. It requires political will and funding. A final thing about vaccines, you will be encountering people who have concerns about the vaccine. You will encounter people who are family members, who are usually very scientifically literate, as well as people who are quite confused about lots of other things, or who are far out conspiracy theorists. Please approach those people with calm and kindness. We know that shouting at people only makes things worse, even though I would love to a lot of the time. Calm explanation that the vaccine is safe. I will be having it, you will be having it. There's lots of advice online about how to deal with those things, and please try to help. As I've had COVID, do I need the vaccine? Yes, you will need the vaccine. We don't know how long your antibodies last. I had COVID in March, I tested negative for antibodies, I'll be having the vaccine. Right, so yes, we will help with your workplace problems, vaccine questions. If there are any other kind of scientific vaccine questions, I will do my best to answer, even though I'm not an expert. Thanks.
Emma, this is a bit tricky, but I am just thrilled because just this afternoon, I got news from her local health centre that my 90-year-old extremely vulnerable mum, right, who has been shut away with nobody looking after her except me for, since is having her first jab on Saturday and then the next one in January, and it's too late for Christmas, but my goodness, is that going to make an improvement in all our lives? It's just fantastic. And really, in terms of scientific achievement, that's amazing. I am concerned obviously about that I mean, as a trades unionist and an internationalist, I don't want to be fighting over the vaccine with other people in the world who can't get it. Right, that's one thing. But my specific question, because you're a doctor, is I understand that the Oxford vaccine isn't quite as effective. Its results weren't quite as good, although they're pretty good, right? And it should be used, I understand, but I think they're not quite as good as the Pfizer and the Moderna. Isn't that correct?
Number of factors. So on their initial dosing regimen, it's 70% effective, which meets our threshold for use of a vaccine. The flu vaccine, for example, is only slightly more than 70% effective every year. Changes to dosing regimen brought that up to 90% effective. There are some disparities between how they've tested it and who they've tested it on. So the Oxford AstraZeneca trial has included some people, like a separate population of people who had already had COVID and therefore already had some level of immunity. It also has included some older participants than the other trials have done, who have a less effective immune response to vaccines anyway. So I suspect that there's some degree of trial data variation. There may also be some degree of it is actually less effective. To be honest, once you've got above 70-75% efficacy, as long as enough people have it, you will be able to get herd immunity in your population. So I'm not too worried about the differences between the vaccines, beyond the data about will it reduce transmission, will it not. Moderna has also released efficacy of reducing transmission data, which is pretty good. So any combination of those, as long as we get them to people, will work. Interesting what you've said about scientific achievement. I think one of the things that this has shown, how quickly this has happened, has shown how much the pharmaceutical industry gets in the way of scientific progress. This year we have had profit be damned, usual application processes for grants and financing thrown out of the window, people across the globe willing to pour money into collaboration, particularly governments, public money poured into collaboration across the globe, accepting a high amount of waste. So the number of vaccines that they have thrown out has been very high. The number of things that they have gone, oh, right, that doesn't work, get rid, has been very high. And they've accepted that because it's such a pressing problem. But actually, there are lots of other pressing problems, lots of other pressing emergencies in medicine that are not normally treated as emergencies, like HIV and malaria and TB and even Ebola, that they mainly ignore because huge governments like ours and the US and other places don't pour money into those things. And so the pharmaceutical industry has quite tight financial control of the development of those treatments, vaccines, etc. We could do so much better than this in a different system. And the fact that we've done this, it shows how well science can do when freed of the constraints of capitalist pharmaceutical production.
So one of the things I wanted to add really was that the measures that we're talking about needing to take for a zero COVID strategy are measures we should have anyway, aren't they? They're about having an effective public health system, not privatising our NHS, funding it properly, about having decent sick pay, about having good workplace safety and the ability of workers to enforce that ourselves. And that's important, not just because even if all our hopes about the vaccines come true, even if it does prevent transmission, even if we do manage to get to herd immunity through vaccination, which is by no means certain, that's many months away. But also we know that pandemics are becoming more frequent because of the ecological damage being done with deforestation and climate change. So putting in place the kind of public services that we need and the social infrastructure and tackling the inequalities that have magnified the impact of COVID, these are all money in the bank in terms of our ability to cope with future pandemics that come through. So the campaign for a zero COVID strategy can save lives now, but it's also about making sure that we have in the longer term a proper set of social systems that can allow us to cope with future infections.
Yeah, I was just going to say thank you to everyone. The speeches have been brilliant. I work in mental health services and I've seen sort of some of the lack of any action taken to protect some of the least vulnerable on inpatient wards. So I agree with Ian that the more we get in place now, the more sort of protected we'll be in the future. So I just wanted to say that. But the other thing is that I have noticed with the unions, I'm in Unison myself, I'm a branch officer, but I have noticed that listening to people, quite often they're promoting the rights of the workers alone and paying, in some cases, inadequate attention to the people that we are providing a service for in public services. So I say that for mental health services, we've had meetings about workers and everything, but, the patients on the wards weren't given masks. There was no social distancing implemented. People were on dormitories with no partitions with people who were really ill. The list goes on and on. But I thought, just think about closing down the schools and the implications that had on children and the implications it had for children in more, higher levels of poverty and deprivation. They had no access, for instance, to devices, to do homework and things like that. So I'm just saying that if you lock down, you have to put in precautions to ensure that the future generation are educated. And I know some people have done that. It was just an observation, and it did prevent me at one point voting for the zero strategy, because I just thought there was inadequate attention being paid to the future and the situation that some of these families and children were in.
I think it was Rory O'Neill from the Hazards magazine said that the pandemic didn't cause our occupational health crisis, it exposed it. And I think that's where we stand, you know, that's where we start from. So we've got two things that we need to do. One is that we need to get out of this crisis. We need to find a way out of it. And there's ways to do it. We've been given the examples of different countries that have actually done something about it. In our workplaces, we don't let our employers off the hook. You know, we've got health and safety laws, we've got standards that they should be adhering to, and we need to make sure that they're doing proper risk assessments, that we're looking at those risk assessments and making sure that they're controlling all the risks. And the risks from ventilation, you know, we need to make sure ventilation is actually top priority now with aerosol transmissions. Hold them to account, make sure that they're doing all the things that they need to do. And if they're not, then report them to the HSC, report them to your local authorities, and we will try our best to back you up in anything that you do to try and force your employers to act in a proper way to controlling the risks to our health and our safety. And in the long term, you know, we've published, I think Ilda's put in the chat about our manifesto. So before the pandemic, we were looking at how we could improve our health and safety, knowing that politicians of all different shades had battered health and safety for years. We've had decades of it. And so this isn't just Tories, this is all political shades. And we need to get a proper health and safety system that's properly funded and that is supporting workers. And it's just showed it up through the pandemic, how important that is. And we need to campaign. So we need to fight now for what's happening in the pandemic, and we need to fight for our future, you know, for proper health and safety and proper secure workplaces, safe health safety workplaces.
Yeah, I just want to make a couple of more general political points, because this is obviously only going to get solved at the level of national politics. There's no other way of implementing the kind of measures on the kind of scale that's necessary than that kind of action. So the question is, how do we generate that kind of political impact? I'd say the first thing is, of course, there's always arguments to be made, but lots of ordinary people very clearly understand these from their own experience already. If you look at the opinion poll that came out today about what people think about releasing the restrictions over Christmas, there's only 31% of people think that it's still a good idea to do that, while 57% think that the more severe form of lockdown should stay in place over Christmas. And that's after weeks of propaganda from the government and the shops and the pubs and everybody else saying, oh, we've got to open up, we can't keep on having a lockdown and so forth. And in spite of all that, the vast majority of ordinary people think that it's a case of safety first, of health first. And they're absolutely right about that. And we should draw confidence from the fact that this isn't an argument which it's hard to make out there. The second point I'd like to respond to is the question of schools, because it's crucial. The only way the first lockdown came about is because a combination of public pressure, the action of the teaching unions and of parents forced the government into closing schools, and that made the whole question of people still going to work and the rest of the economy impossible to follow through on the government's terms. So this is obviously always going to be an absolutely crucial front. Now, I completely agree with the point that Jane Lee made, that children who are missing out on their education should be provided with the means insofar as this is possible, both technical, teaching online, equipment and so forth to be able to continue with it as much as possible. But, and I have to say this very, very clearly, the rich don't look on it that way. Eton is closed. Dulwich College in London is closed already because they aren't going to treat their children in the way that their government is treating yours or your family's children. They're very clear that safety first means closing the schools, and that's the starting point that we should have. If it's good enough for the children at Eton and Dulwich College, it's good enough for the children round here in Hackney or in any other working class community. Then, of course, we do have to have the argument that the facilities, the equipment, the teaching should be supplied. But there's no argument about that if you're still sending people to school. And I don't think it's only the case that when people are withdrawn from school, poor kids are suffering. My niece is a teacher in the poorest school in Taunton in Somerset. They're now and she teaches, she's got asthma, she shouldn't be teaching. She teaches in a classroom with 30 pupils, with the doors and windows open, where they're now collecting clothes because the children are so cold in the classrooms during the teaching. So whichever way you look at this, there's a class question at the core of it, and that has to be resolved. And that's the whole point of the zero COVID strategy. It's saying that we want safe conditions, we want the vaccine to be developed, to be freely available, to be distributed by the best possible methods. But until that happens, we've got to have a circuit breaker which stops the COVID spreading. And even when it does happen, by the way, the vaccine on its own won't be sufficient. And if this is the prospect, then it has to be absolutely clear that we won't pay with our welfare state, with spending on welfare, with wages, with conditions to have a safe society. It's perfectly possible to have a livelihood and to save lives. And therefore, I really recommend that people make the COVID Charter the frame of debate. And the way to do that is to publicise it among your friends and your family, to spread it on social media, to take it to your trade union branches, to put it into the Labour Party, to lobby, as Richard said, the MPs and councillors about it. Let's make this the frame of debate and not the insanity coming out of the government over this issue. And the government simply doesn't have a coherent strategy. It's driven from pillar to post. Each time the death rate climbs so high, it has to implement measures, it implements the measures. Then the Tory right wing kick off and the business community start moaning at them and they abandon the measures. That's the only guidance that the government is operating under, and that has to stop.
Yep, quickly on the question that Liz has asked, saying, are the vaccines new? They are new in the sense that we've not had vaccines for COVID-19 before. They are not new in terms of the scientific basis of them. Both the types of vaccine have existed and been tested before, so not new tech, new target. On spread to service users, patients, people living in residential facilities, prisoners, etc. Everybody who is either detained or necessarily in a kind of communal living area like a hospital, for example, needs special attention. I was working in psychiatry when this kicked off, and psychiatric services especially are not designed to contain any kind of infectious disease. And in fact, the staff preparation for any kind of infectious disease, whether that be flu or a diarrheal outbreak or COVID, was very poor. And we had to set up completely new systems of working to safeguard patients and staff in that setting. It needs a lot more attention. We know that hospitals are facilitating spread still. Lateral flow testing might help with that. It remains to be seen, but yeah, absolutely needs further focus. There are solutions here. They are traditional, well-known, tried, tested public health measures. They are locked down until cases are low enough to run an effective test, trace, isolate and support system. Testing is worthless without isolation. Isolation doesn't happen without support. There needs to be political action, as we've described throughout this meeting. There needs to be workplace level action, as we've described throughout this meeting. There need to be individual choices, but we need to facilitate good individual choices, and we haven't been able to so far. So in order to push that, I would encourage you to do all the things we've been talking about in this meeting, but also to have a look at Zero COVID UK, which is zerocovid.uk, literally all around me, to join that campaign. You can create a workplace group or a community group with only 3 of you. It's very, very easy to do so. We've got some resources. We're linked with Hazards, we're linked with Independent Sage, and we will help where we can and enable you to do the things that you need to do to make yourself, your families, your colleagues, and everybody else around you, the rest of the UK, safe, and to move on from this. We can and we will get back to normal, but there's some action that needs to happen to make that available as an option for us. Thank you.